So I want to talk about this article that just came out of molecular psychiatry. This article is essentially comparing the genotype and phenotypes of ADHD and ASD, as well as the biomarkers and structural abnormalities within the brain. So one of the things they found is that overall, for both ASD and ADHD, there's a lack of specialization in the connectivity of the brain. They might be less intricately connected, or they might not be as specialized or organized in their function. One of the things they found is there was an association between the severity of an ASD diagnosis and whether there were changes in certain areas of the brain. So those areas were the frontal parietal network, which is like this area here, left middle frontal gyrus, which is one of the bumps on the brain, and the left posterior cingulate cortex. Those three areas were found to be aberrant in some way, both ADHD and ASD, but the further severe you get on the autism spectrum, essentially level 2 then to level 3, if we're thinking in those terms, the more significant the brain differences in terms of the structure and or the connectivity. These areas are responsible for language, emotional, and sensory motor functioning, which we know can often be atypical in people with autism and ADHD. So this kind of tracks in terms of what we're seeing within the neuroimaging compared to what we're seeing behaviorally. There's certainly a connection between ASD, autism, and ADHD, attention deficit hyperactivity disorder. So what this is showing is that people who have high functioning autism are more likely to have a traditional diagnosis of ADHD in terms of, forgetfulness and aloofness and inattention. The people who have more severe forms of ASD are more likely to have co-occurring ADHD if it's more related to their behavior, like hyperactivity and impulsivity. But that can also be true for someone who's on the higher end of the spectrum. So you have this horizontal spectrum that is kind of elucidating the severity of autism, and then this vertical spectrum that's kind of describing the type of ADHD, because right now we only have 3 types. Same like we do with autism, we have inattentive, hyperactive, impulsive, and combined. Because these things aren't divided up well enough, it's very complex and the overlap is confusing. This study reported that 32% of people who have ASD have co-occurring ADHD, meaning they have both disorders. The other thing that was interesting is that there was significant overlap in the questionnaires. So, for example, people who were diagnosed with autism, when their parents were given questionnaires for ADHD as well, they tended to score high in ADHD, even if the clinician didn't find that they necessarily had it. And the same was true vice versa. So if they had ADHD, they tend to score high on autism questionnaires. And not only autism questionnaires, but actually the ADOS-2 itself, which is the gold standard for assessing autism. And in fact, one of the major developers of the ADOS-2, Catherine Lord, is one of the co-authors on this article. So what they found is that people with ADHD often met criteria for autism spectrum on the ADOS-2. So the ADOS-2 has 3 classifications, either non-spectrum, autism spectrum, or autism. Falling in the autism category is supposed to reflect most severity, whereas non-spectrum, of course, would be the least severity, showing minimal autistic symptoms. So autism spectrum would be in the middle. The other thing they found is that we know both ASD and ADHD are highly heritable, meaning you can inherit it from your parents, but the parents' diagnoses didn't always line up perfectly with the child's, meaning you might have one parent who has level 1 ASD, and you might have another parent who has level 2 ASD, and you might have a child with ADHD and no ASD. You might have one parent with ADHD, one parent with level 1 ASD, and have a child with level 3 ASD. So there wasn't a direct correlation. It's kind of like if you have a parent with ASD or ADHD, you may have a child with ASD or ADHD or a combination, further providing evidence that there is genetic overlap and structural overlap in these disorders. And lastly, what was kind of surprising is that the people who had ADHD and level 1 autism had more shared biomarkers than people who had level 1 ASD and level 3 ASD, meaning that although they're called the same thing, autism, level 1 and level 3 were more different than two disorders with different names, meaning ASD level 1 and ADHD. So I thought that was really eye-opening, just to show how we label things, and it doesn't necessarily correspond with the underlying genetics or biology.